come.
Okay, we're done. Did you hear the screams? It was
Muffled them, muffled
It was
them.
like I go,
Tape,
it's good.
lots of tape.
We'll play the game again. Why don't you, lady in the third row, do you want to hold some fingers up this time, see if you can do those?
3 count. I don't know if
That's kind of cheating, isn't it?
That's cheating.
How about the lady with the purple in the aisle?
more.
That's not too bad.
3.
You're close, yeah. How about the lady, I don't know.
Why don't you just do someone in the middle?
Somebody
This
in
is
the middle?
light.
Yeah, there you go. There's,
5.
okay, there we go. How about the gentleman? There you go.
Yeah.
Two very large fingers, yes. How about
Lady in
one of the guys on the back row in the middle? There we go.
Oh,
Oh, that was cheating. You can't see that far.
Can you tell?
hell.
That's okay. He's not holding
No.
any fingers up.
It was a fizz.
Now tell him what it looks like right now, okay?
No. I think, like you said, wax paper thing. Not as bad as when I first came out, but
It gets
it's a little hazy.
It actually gets better by the minute. It does. It's the first 24 hours. It's an amazing time. You know, every hour it's a little better. Do you guys have questions you want to ask? But by no means is it
For him.
perfect right away. Okay. You need
But it's
to know
much
that.
better.
It's swimming pool vision. It's
Yeah.
chlorine vision.
What'd you do with your glasses?
They confiscated them earlier.
Do your eyes hurt?
I can't feel anything. I was, even though they say it doesn't hurt, I was expecting a little discomfort, and there was none whatsoever.
Yeah, I'm the one that held up 0. But
Yeah,
I
he's a
turned around and
troublemaker.
looked,
Watch out.
and I realized with all these pictures on the back here, did that cause problems for you seeing
It
the
could
number of
have. I
fingers or
figured I
lack
had
of
a
number of
fist
fingers?
eventually, but
If you turn on the lights and you had something in the background that wasn't those pictures, he'd make it out. In this place, his biggest risk in doing this surgery is rubbing his eye in the next 18 hours. Of all the complications we see, the biggest problem we've had is people who reach up and forget and do this. So we're going to put some goggles on him here in just a minute before he gets a chance to do that. Okay? And I've warned him seriously because of the 40 people that have tweaked their flaps in the last 7-8 years, 33 of them are young guys. Okay? And the reason is mostly because young guys are indestructible and they think they can take their goggles off and they're home watching TV and they forget and they reach up and they do that and they tweak their flap. And that's all it takes. Now by tomorrow morning, if he forgets and did that, it won't move. But tonight it would. And then for 5 nights, you know, we all rub our eyes in our sleep. The sleep apnea study showed that. So for 5 nights, if Kev was to reach up and do this, when he was asleep, he could still damage it, even though tomorrow it won't move with casual touch. So he's going to wear these goggles till he wakes up tomorrow morning for 18 hours, and then he's going to wear them for 5 nights when he sleeps. That's the biggest risk he faces, okay?
I just wanted to ask about infection. Usually when you go in for any kind of little surgery, they kind of automatically put you on an antibiotic. Is there anything like
Yes.
that involved?
He's already had some put in before the surgery, and he's going to have some put in twice more tonight, once in the back, once before he goes to bed.
So it's a drop antibiotic?
It's a drop.
Okay.
There's a drop for infection and inflammation. You've hit the 3 things we worry about: rubbing, infection, inflammation. Okay. Any other questions for him? Because otherwise we're going to run in the back. Okay.